Again, I'm Martin Pregler from Brainlab in Munich, and first of all, thanks a lot for the invitation. I hope you can see my first slide, digital surgery, today and tomorrow, and I will give you now some insights about this topic. And before we start, I want to show you a quick video.
Cancer, the emperor of all maladies. It is a frightening disease for which currently there's no cure.
My oncologist suggested a brain scan because I hadn't had that tested. There were 3 tumors. And actually, I was prepared to die.
We are unquestionably in one of the most dynamic and exciting periods of medicine for cancer treatment.
We really have to think about what their quality of life is going to be, and quality of life starts with what's up here.
I no longer think about dying, you know? I don't. And that's, I think, pretty dramatic.
So in fact, Brainlab today changes the lives of millions of people with life-threatening diseases. And I guess many of you know somebody or even have a family member or friend fighting their own battle against cancer. So fueled by the drive to increase access to and consistency of treatment, Brainlab focuses on boosting cancer survivorship by developing new and minimally invasive methods to treat cancer of the brain and body and increase patient comfort during treatment. So about Brainlab, we were founded in Munich 30 years ago, and our core business is medical software solutions for oncology and neurosurgery, as well as spinal, ENT, CMF, and trauma surgery. Our software is installed in roughly 5,500 hospitals around the world, and we have approximately 13,000 systems installed. We have customers in 116 countries and around about 1,400 employees worldwide from 74 countries. And around 800 employees are working in our headquarters in Munich. And we have 19 offices around the world. And my name is Martin Pregler. I'm working for Brainlab since 8 years. And I'm Director of Government Affairs. And in this role, I met Dr. Hermsmeyer last year. And yeah, as just mentioned, we started 30 years ago developing imaging software for doctors. And what we do today is we build navigation system for doctors, like a GPS system for the human body. And what you can see here is our latest system. And what you can do with our software is you can plan procedures, like planning a trip with Google Maps. Where do you open the skull? What's the safest way to the tumor? And you can do it, and to do this to try avoid like critical structures, like vessels, like a brainstem. And this functions like planning a vacation trip with Google Maps. So the basis for all this is CT and MR scan, and this is like the Google Maps. And then with our software, you can segment the tumor, you can segment the vessels, and you can plan the procedure. And you can do this in the hospital, you can do it at home, you can exchange the information, and you can then afterwards, next day, perform the procedure. And all the slides I show you, this is all current technology, and this is used like in the leading hospitals around the world. And here you can see like a tumor in the skull, in the brain, and with the software, the doctor is able to go through the procedure, and here you can see where he wants to open the skull and try to get out the tumor of the brain. And within the software, you can mark all the important structures, for example, the brainstem, or the motion center, the vessels, the fibers. And the goal is that you do not destroy these important parts of the brain. And yeah, that's like a daily procedure in the major hospitals around the world. Here, this looks like a precise alignment of an instrument to a pre-planned pathway. And what you also can do is, with the software, for example, you can do a spine surgery. And with these tools, you can plan the screw that it fits perfectly to the spine. And what you can also do with our software, for example, is planning a perfect cut, either for an implant for knee, for a hip, or a spine. And another important thing is, when you perform a brain tumor surgery, is that you use the microscope. And with the microscope, our software is able to do like augmented reality. So with the microscope, you can see the surface, either of the skull, of the brain, wherever you zoom in. And with our software and with our technology, the doctor is able to see behind the surface in terms of augmented reality. And all these software solutions help the doctor to perform a safer and better procedure. And here, this is also like an example for augmented reality. This is the view from a microscope, and our software shows the doctor the tumor behind his behind the scene. He can actually see with his eyes through the microscope. And what is also like part of digital surgery today is using intraoperatively imaging. Here you can see an example where we use like this is called Aero. This is one of the first mobile CT scanners. And with this technology, you are able to perform intraoperatively CT scans. And you can verify, for example, the position of the screw during the procedure. And all these images help the doctor to, for example, if one screw fits not perfectly, he's able to replace the screw within the first procedure, and it's not necessary to perform a second or third spine replacement. Another example for intraoperatively imaging is ultrasound. And because not everybody or not every hospital has an intraoperatively CT scanner, and for these customers, it's also very important that they have the opportunity to verify the procedure intraoperatively. And here you can see, for example, the opportunity to perform or to get information with an ultrasound device. What is also part of digital surgery today in the use of a robot. And here we developed a system which is an add-on, like an assistant arm, to stabilize the procedure and to find the perfect trajectory, for example, for spine surgery. And how the system works, you can see in the next slide. So the doctor does the alignment, and the robot detects the perfect trajectory as the trajectory was planned the day before, and you can now then put or fit the screw exactly where you have planned it. And yeah, the robot helps the doctor that he can perform the procedure like in a stable way. And yeah, this is also like part of the daily procedures in the hospitals around the world. And yeah, another example I want to show you for surgeries which take place in daily is like radiotherapy. And here you have also like the crucial part that you perform the procedure very accurate. And for this goal, we developed like a system which is called eccentric dynamic. And here I also want to show you the workflow within a short video. And yeah, as I just mentioned, it's a similar technology to capture the position of the patient to precisely aim radiation beams to a spot deep inside the patient. And yeah, the example is for how multiple sources of data like surface, thermo, and X-ray are correlated and combined in a single model. And again, software enabling better treatments. And with this software, we are able to treat, for example, here, metastasis from every corner exactly with the shape of the metastasis. And here you can see, like when you plan the treatment, you can simulate where is the brainstem, where is the tumor, where which tissues will get which radiation, and all this is possible with digitalizing the surgery plans. And yeah, when we come to the question digitalization of surgeries, how do we get inspired, and what are the important next steps, and how innovation comes from? And there I have another short video for you that you get an impression how we or where we get our ideas from. And probably some of you know this movie with Tom Cruise from Minority Report, where you can manipulate crimes in the future. And this movie was like the reason why we developed several years ago the so-called digital light box. And everybody of you knows like the light boxes where you can see 2D X-ray scans. And we thought, this might be a good idea to develop like a touch display where you can manipulate, plan, view, share images from a procedure within the OR and share it with other doctors, use it for teaching. And the result was the digital light box. And with this technology, you have like several apps, and you can record, stream, view, and plan procedures within the OR. Again, you can use it, or you can use it with an app. You can plan it from home. You can get like the advice from a doctor who's not in the OR. And again, this technique and this software is used today in many hospitals in Germany and also around the world. And I believe it's very obvious that and clear that the benefit from these technologies, that it's easier for the doctor to understand what he's doing. He can like better perform and prepare for a procedure because he has a better understanding from the structure of the human body. And that he gets even a better understanding what he's doing. We developed for the doctors the so-called atlas, and how this atlas for the human body works I will also show you within the next slide. So we developed for the entire body tissue classes from the brain to the inner body. We detect the muscles, the vessels, and all the organs, and like really the very, very tiny pieces. Everything is like within an atlas. And the workflow is like that you have like a scan from a CT, MR, and then it gets mapped with this universal atlas. And with this software capacity, we are able to categorize every human body to a general model. And because every person is like a similar, so the structure of the body is similar, but it's not equal. And this you can see in the next slide. So for here, this example, we have 5 scans of the brain, and it looks a little bit different, but the basis for everybody is the same. And with this atlas, we are able to match the individual brains to the general structure. And then with this software, the software automatically does this and provides the doctor right away the structure for the further planning. And we do this with software technology, which was developed in the past 30 years in our headquarters in Munich. And here you have like the opportunity to do peeling an onion, and you can see the different layers, and this gives the doctor the opportunity to really manipulating all the different structures on a very tiny level. And this is all based on technology that pre-processes and organizes data in the background. And nobody has a suite of tools comparable to Brainlab for this. So here you can see the brainstem, the fibers, the vessels, the tumor. And this capability is not just applicable for the brain, but for lung, for liver, etc. And by using texture mapping, you even get really photorealistic representations of the anatomy. It's very powerful if you aim at mixing into the real world using spatial computing. And here you can see we can detect the tumors in the lung, and we can really detect with our technology the motion of the tumor in the lung. And this is very important for the doctors, this knowledge, to plan the procedure afterwards. So, and here again, a short video that to get a better understanding how we do this. So we have the CT scan, and then we do use like a small, tiny voxels to really map all these parts of the brain or other parts of the body to the software model. And yeah, this is just like was like a very quick overview about the digital parts of surgery from our portfolio. So from the opportunity to plan procedures for brain tumors, for spine, for hip and knee surgeries, then afterwards to perform the procedure in the operating room, and also like for the planning of and treatment with radiotherapy. And this is all part of the current portfolio. This is all used today in many hospitals. And so this is the status quo and what will be now the future. And the future, from our perspective, looks very bright, and one part of our future portfolio will be like the mixed reality applications. And now, or in the current setup, if you have a procedure today, the doctor is using like navigation system, as I showed you in the previous slides, and this is like a hardware which is also like developed and specified by Brainlab. And in the future, the doctors, from our perspective, they will wear like mixed reality glasses, and the doctors will get all the information which is necessary exactly at that point in time during the procedure when they need the information, like a head-up display for if you drive a car. And this is already developed or was developed in the past years, and we have like a collaboration with Magic Leap in America, United States. And yeah, it's the planning application is already released, and it's already used in over 80 hospitals around the world. And the next step is that we use this technology during the procedure in the operating room. And here, yeah, probably some of you know already this application or the tool. And like the goal is that you have here like a picture of an operating room, how it looks today. You have table, you have the screens, and we want in the future that all this hardware that's not necessary anymore, that all the displays and all the information which is shown on the display will be shown within the mixed reality glasses, and the doctor gets exact information at the point during the procedure when he really needs it. And yeah, how we or how this could look like, I will also show you in one of our the next slide. And with the mixed reality, you have the chance to see behind the scene. You get all the information within the glasses. You can manipulate it. You can view it. The cameras in the glasses detect the right instruments, give you hints if you might grab the wrong one. and this is the technology where we believe that this will like really dramatically improve the procedures, and yeah, hopefully at the end of the day, patients with, for example, tumors can get like a better procedure, and then afterwards a higher quality of life after their they got treated. Yeah, so that's it from my point. I hope I was able to get to give you a quick introduction about digital surgery, what is possible today, and a small outlook what will happen in the future in the operating rooms. Yeah, and now actually I would be open for questions, but I do not know how this works with this remotely, but probably Heike,
Yes.
we will have the questions afterwards, or discussion after the second keynotes. Yeah.
Let's see. So thank you very much. That was impressive. And I and my generation very well knows the Minority Report cinema or history, and so far I remember very well what happened there, and I was really impressed that this is currently possible. I have from my side some questions, but so Dirk, are we aware whenever somebody from the participants has questions?
I hope so. I didn't explain this yet.
Yes.
What we want you to do is, if you have a question, please virtually raise your hand. And you can do that if you click on the Teilnehmer, or if you're using an English version of the Zoom software, participants icon, then you should be able to see a sign that says raise your hand or Handheben. And then hopefully we are going to see this with 126 present participants. And then we would ask you to switch on your microphone and use your microphone to ask your question.
There's one, I see one hand.
Ah, where do you see? Ah, yeah.
The name is Malte.
Malte, please switch on your mic and...
Okay, now everybody can hear me, I hope so.
Yes.
Yes.
Great. Martin, I have just a question regarding AI in your business. So, I mean, this whole conference is about AI and regulatory affairs, and I've seen just a lot of applications where I guess AI plays an important role in the future. Yeah, in terms of workflow, in terms of precise medicine and so on. Can you comment on maybe where Brainlab focuses in this regard?
Of course, there are many examples. Probably one good example is the planning for radiotherapy. So today you get the CT and the MR scan, and then the doctor plans the procedure within our software based on his knowledge and experience. And we have like research collaborations with some university hospitals. And the goal is that we get, or we are currently working already on it, to get the real world data from the patients, of course, anonymized and with patient consent, and that we can perform the planning based on this real world data, and the AI applications can then do the planning automatically. And the doctor is able, like Google Maps, you show the Google Maps where you want to start and what's the destination, and the same is the goal with our planning software. That you that also another part is like that patients from regions in the world which have not the latest technology, but then, or like the doctors with very good experience and knowledge, then they can also get like the plans based on the AI algorithms, and they are like jointly developed with the best doctors and their experience, and also like what we take into consideration is like patient-reported outcome measurements, what was good for the patient, what was not so good, and all these will be then used for the software algorithms. Is this like a answer for your question, Malte?
Yeah, I just wanted to hear like where you're focusing on. So
yeah, there are many other aspects where we are focused on AI, but this like the planning based on AI algorithms and with real world data is one part of it.
Interesting. Thank you very much.
Of course.
Thank you. So I have one further question. So I believe that physicians or doctors need a lot of training in order to use the technology. So I believe that innovation is one thing, but the other is also the training and the acceptance from the side of the doctors. What is your experience here? Is that a hurdle, or is that easy to be trained?
Of course, training is a very important, and there is not a clear answer, yes or no. It's like it depends. So, of course, the young doctors or the young neurosurgeons, their education is already based on the latest technology, and they're sometimes more open to these kind of technologies. But end of the day, our goal is that we develop software which is almost self-explaining, so that the workflow is really very smooth. And but of course, it is really crucial that the doctors get trained very well. And for this reason, we have 2 huge training centers, one in Munich, one in Chicago. But also like the remote training and remote access to these engines and to the planning gets even these days very important.
Yes, especially in these days. Yes. Okay. Thank you very much. So thank you for the presentation. I believe we do not have any further questions. Thank you. And we will have a discussion after the next presentation together with you. So we will combine, we'll have combined questions, but thank you very much. So according to my schedule, we will now have a 5 minutes break. I don't know as to whether this is enough time for yoga or something like that, but it's a bio break, and then in 5 minutes we will then start with Ms. Truxius and the cybersecurity presentation. Thank you.